Hello, in this video I'm going to be talking about weight gain during breast cancer and its treatment and afterwards. Before I go on, I'd love to invite you to subscribe to our channel. We cover topics just like this, as well as ones regarding treatment, living with long-term effects, and what to expect as you embark upon breast cancer treatment and its aftermath. I'd also love to invite you to go to Yerbba.com to get your personalized report. That'll help you as you watch this video and see the different types of treatment that can cause weight gain and what to expect. So it might be helpful for you to check that out as well. Weight gain during and after breast cancer treatment, I have to say, is one of the most distressing side effects and long-term effects of breast cancer. You know, we put a lot of stock in how our body looks and in our health, and also there's a bias against people who are heavier. There's anti-fat bias, and there's a pressure on people, especially women, to stay thin. I'm not going to go into that a lot, but I'd be happy to do a video on that if it would be useful for you. So just drop a comment if it would. So weight gain is really distressing, especially if this is something you've struggled with your whole life, if you have disordered eating, if you live with an eating disorder, or if you've always been slim and now you find your body changing. A couple things just to add: we all gain weight with time. On average, we gain 10 pounds every decade. It might not be a pound a year, but on average, every decade we age, we gain 10 more pounds. That again is on average. If that doesn't apply to you, you are not average, you are an individual. But that's just the average of what we see in the population. The other thing is, if we have functioning ovaries and then they stop working, whether it's temporarily or permanently, these changes we see with menopause, whether it's natural and just happens with time, or if it happens with treatment, also affects our body composition. There's probably an evolutionary reason for that. There's probably a beneficial reason to gain weight, but when it happens to you, it may not feel beneficial. We're also not good at accepting our bodies and deciding that this is my body and I'm going to love it anyway. So just think about it. With time and with menopause, there are a whole host of other issues with our identity, with our views of beauty, with being invisible, with being honored in our society, no matter where you are in the world. And of course, this does vary by culture, but this is why it's upsetting. I will say, even if you don't go through breast cancer and its treatment, weight gain happens with time, menopause happens with time if you have ovaries, and so weight gain is sort of part of aging. And while we don't want to age, we actually want more years. In particular, chemotherapy can cause weight gain, and there are a few reasons for that. The main one, well, there's several for these, but the first one is what happens during chemotherapy, and that is that we give corticosteroids like dexamethasone, the brand name of it is Decadron, to prevent nausea. This is really important. If you're puking all night, you're going to be exhausted, you're going to dread chemotherapy, and there are other side effects that steroids can help with. In people getting taxanes like paclitaxel and docetaxel, people can get something called capillary leak, and steroids are really essential to prevent capillary leak, which is swelling of the fingers and toes, and really the whole body can happen without steroids. The other thing that happens during chemotherapy is, first of all, a lot of people think they'll lose weight, and so they tuck in. They eat a lot of food, and people bring over meals to help nourish them. So we want to nourish the body, but a lot of people think they're going to lose weight and end up gaining weight. The other thing is, we're not as active. So if you're taking time off work, you're not getting those steps in that you get from the parking lot to the office, from the office to the cafeteria, back to the car. You know, when I'm at work in the building, it's 10,000 steps. When I'm at home, it's about 2,000 steps a day. So there's just a big shift when we're not at work. Other things happen. We might not exercise because we're fatigued, we're not sleeping well, and so we're not moving as much. People tell us to take it easy, and we need to heal. So there's a lot of reasons why we gain weight with chemotherapy. It's not inevitable, so lots of people have been able to maintain their weight. through things like daily weighing themselves, which I actually think has a lot of other problems, especially for people who have an eating disorder or disordered eating. The next thing I want to talk about is endocrine therapy, like tamoxifen and the aromatase inhibitors. It is very common for people to report weight gain when they're on tamoxifen or the aromatase inhibitors. These treatments are used in people who have hormone receptor positive breast cancer. If you're watching this and you're not sure if this is part of your treatment plan, this is an invitation to go to Yerbba.com to find out if tamoxifen or the aromatase inhibitors might be part of your treatment plan. So these drugs can resemble menopause, not tamoxifen. This doesn't shut down the ovaries, but the aromatase inhibitors will lower estrogen. And by resembling menopause, we can see weight gain. In the clinical trials that have been done with the aromatase inhibitors and tamoxifen, the later trials, not the earliest on ones, but the later trials where we looked at things like weight gain and other quality of life things, people on the placebo, people who received the inactive drug, a sugar pill, if you will, and it wasn't a big sugar pill, it was a small one, so it didn't have a lot of calories, and people on tamoxifen all gained weight. So you will hear doctors saying people don't gain weight on tamoxifen. Well, they do, it's just they don't gain more than they would have on a sugar pill. So we, again, all gain weight with time, and it's not different if you're on tamoxifen versus a tamoxifen lookalike. I will say though, after 30 years of practice, that I have seen when people come off tamoxifen or aromatase inhibitors, they lose weight. And I'm not sure if it's because of the direct effects of the drug or because they're sleeping better, because their hot flashes are better, or if they feel like they have a new lease on life because they're done with their cancer treatment. So when I said that people don't gain more weight than on tamoxifen, please don't hear me saying that they don't gain weight. And when people come off tamoxifen, and when you listen to your patients say, I dropped 5 pounds when I came off tamoxifen, it's hard to ignore that there is a link. The other thing that happens is our body composition can change, so we can lose protein. When you have cancer or are going through its treatment, our body shifts from muscle building to muscle breaking down, and steroids can make that worse. So staying as active as you can, including things especially with your proximal muscles. Your proximal muscles are the muscles that help move your thighs, so climbing steps, lunges, squats, and lifting. So lifting with our shoulders and arms, our back muscles, those are the proximal muscles. They're closest to the core, and trying to maintain muscle strength. This might even just be lifting up cans of beans. If you've never worked out before, check with your doctor, especially your surgeon, but you can get a resistance band. You can join the YMCA if you're in the States, or a community center, and just try to maintain your muscle mass and try not to lose muscle, because that makes it hard to rebuild and get back to exercise, because we're in this catabolic state where we're breaking down muscle. The stress can do that. Making sure you're getting enough protein. You can talk with a dietitian or your physician about, do you need to get extra protein? It's very likely that you do and should around surgery, chemotherapy, targeted therapy, and really just, in general to maintain health, especially if you want to maintain or build muscle. Protein's really important. So there are a whole host of things that happen. The other things that happen with treatment, whether it's chemotherapy, targeted therapy, surgery, radiation therapy, or endocrine therapy, is disrupted sleep. When our sleep is disrupted, it changes how the hormones work in our body. We can see higher levels or just altered levels of hormones that cycle, and this can lead to weight gain. So, and we're not talking a lot of weight gain here, but even 5 pounds can help us feel less good about our bodies. And as I mentioned, continually gaining even small amounts of weight will build up over time, the many years that we of course hope that you have after breast cancer. I've covered a lot in this video. Share your experience with us in the comments below. You can ask a question. You can ask a question like, can you make a video about something else? We will get back to you in 1 to 2 weeks. You're part of the Yerbba community just by watching this video, and when you contribute to the conversation, you're sharing your experience and helping other people. We do have a zero tolerance for misinformation, so if something is patently false, we will put that in the comments to alleviate the suffering of other people reading comments. Thanks as always for watching, and we'll see you next time.